Stress can range from something as normal as waking up early in the morning to go to school or work, or dealing with family or people around you, or it could be something as simple as doing your laundry or adapting to the changes in weather. Stress is a normal part of everyday life, although it can have huge impact on mental health. So it's an important topic to investigate. And stress can affect how one sleeps, can affect one's perception of pain, it can affect their senses. And the body goes through this natural stress response, which will secrete hormones throughout the body. And these have been implicated in psychiatric conditions like mood disorders, trauma disorders, dementia, substance abuse. So the brain is going to perceive signals from its outside environment, either like through the senses, either through one's vision, what they hear, what they smell, even what they taste. And this sends signals to the brain. There's a region in the brain called the hypothalamus, and this generates hormones that are secreted down to the other glands of the body. And in particular, where it plays a role in stress is when it secretes hormones to the adrenal gland, and the adrenal gland secretes hormones like testosterone, progesterone, also secretes cortisol. Cortisol is known as the stress hormone. Now, this region, the hypothalamus, also plays a role in producing thyroid, producing oxytocin, which is the trust hormone or the social bonding hormone. It plays a role in other functions in the body that deal with body temperature, that deal with blood pressure, deal with growth. So it really is an important role in not only just the stress response, but also how the body functions and metabolism and so forth. When the adrenal gland is not working properly, we see people that develop symptoms such as lack of motivation, or they're withdrawn socially, maybe they get fatigued or tired. They can also have difficulty sleeping. So in a way, it's some similar symptoms to what could be found in like a major depressive disorder. So this communication between the brain and the glands and this hypothalamic pituitary adrenal axis is thought to play a big role in the stress response, and it can also play a big role in mental health in general. In fact, antidepressant medications are shown to help restore the imbalance that occurs in this communication pathway. When there is this imbalance in this pathway, like when there's too much stress or too little stress, or when this axis is too active or too little active, that can cause anxiety or depression or sleep problems, mental health symptoms like that. And antidepressants can restore that equilibrium to make it imbalanced. This hormonal axis, people have different sensitivities to it. For example, that could be based on genetics, based on their ability to cope with challenges in life. It could be based on the perception of their environment or things around them. It could also be affected by any underlying medical conditions or drugs or medications that one is using. So the stress response can also affect the immune system. So the immune system is going to fight off infections and help protect people when they get medically sick or medically ill. But if the stress response is dysregulated, that immune system may not be working as properly, and it can affect the body's nervous system, leading to mood changes, lack of enjoyment in life, etc. And so we also see that in depression or bipolar disorder, there can be immune system changes that one has. And so we can really see there's this close interconnection between the stress response and mental health symptoms. So it's really important people handle stress well. Stress will sort of activate the nervous system response, like the fight or flight response, where people, when they're in a stressful situation, may want to run away, they may freeze, they may even get aggressive and sort of retaliate or fight back at others, because that's what their body's sort of telling them. That's the adrenaline response that the body's going through. They also find that people who are susceptible to the stress response, they tend to be less flexible with perception or what's going on around them. They may be a little bit more stubborn, in other words. So I'm just going to provide an example of how important it is to have a good and clear outlook or perception or view on life. Take, for example, someone in a car going down the road and they nearly get in an accident, but they don't get hurt, but they are able to sort of swerve out of the way or protect themselves where they don't have anything negative happen to them. But if they tend to be anxious or view the situation negatively, like oh my God, I almost got in an accident. They tend to worry, maybe get a little bit tense, anxious, and that can just sort of elicit the stress response, starting from the hypothalamus, signaling to the rest of the organs to sort of secrete that cortisol or that stress hormone. But you take that same example, someone going in a vehicle, nearly getting in an accident, but not getting hurt and nothing bad happening to them, they may look at that situation as like, oh, thank God that I'm safe, or that nothing bad happened, or thank God that I'm protected, or I hope God helps the people who were harmed in the accident. So those types of things are probably more likely, just my thoughts, to increase not so much the cortisol or stress hormone, but the oxytocin hormone. So it's the same signal that's going to the brain, but it secretes different hormones in the body. This oxytocin hormone, for example, which will simulate more or bonding with God. Or bonding with God, it sort of progresses or will go to other people as well and to themselves. It's just some thoughts that how important it is to have a good viewpoint of life, to try to maybe focus on God as much as one can, about those good things about him, and that I think will just help to manage stress or some of the difficult circumstances in life. Again, so much of mental health problems starts with the way one thinks, as that can affect their feelings, that can affect their behaviors. So it's just important to really be mindful of that and try to make sure that one's thoughts are coming from an accurate and true basis. If it's difficult to control the thoughts, like if it's difficult to redirect how one is thinking or distract oneself, then that's really important to consider taking medications to help control one's thoughts. Medications can help calm down the mind and the body so that one has more control over the thoughts they're thinking and can redirect it into more healthy, constructive thoughts. Whenever there's thoughts or feelings or behaviors that are impacting one's life negatively, either through their work or their school or their relationships with other people, that's when it's important to get into mental health treatment with a doctor, a therapist, or some sort of mental health clinician. Hope you like this video. Be sure to subscribe to the channel for more videos, and like this video if you feel it's beneficial or benefited in any way.